behalf of the University of Arizona College of Medicine, Phoenix, the University of Arizona Health Sciences, and Banner Health, allow me to offer you I shouldn't say warm welcome, I should say medium warm, because this weather is actually pretty perfect. Thank you, Mayor Stanton, for the perfect weather this morning. My name is Allison O'Toole, and I'm the Senior Director of Marketing Communications for the University of Arizona Health Sciences, and I'm just tickled that you are all here today in the name of heart health prevention. Today is a very special day as we officially launch the Heart to Heart with Dr. Martha Galati YouTube series that has been fully endorsed by the American College of Cardiology and the National Coalition for Women with Heart Disease. Both of those organizations are based in DC. In fact, yesterday we were on a conference call with the American College of Cardiology, and they have fully pledged to promote this video series to all 49,000 of their members and their patients that are spread out across the nation. So kudos to Dr. Galati. If any of you have had the pleasure of meeting with Dr. Galati, there's one thing that you will find out very quickly. She has a very big heart. She truly cares about wanting to prevent heart disease. Dr. Galati was featured on numerous television shows, including Oprah, my favorite, The Today Show, CBS National News, and many others. So hopping in front of the camera for this video series came very natural and easy to her. This video series is very special, as Heart to Heart with Dr. Galati is designed as if you were sitting here in DeSoto Market having a cup of coffee across from a girlfriend, but she just happens to be a cardiologist. The reason we are all here today is because 1 out of 2 women suffer from heart disease. Just last week, my husband received a phone call that his aunt, who's a very successful entrepreneur, who has not been to the doctor in years, she had a massive stroke. And doctors said that if she had just gone for her routine health exams, the doctors would have caught that she had some blockage and high cholesterol. So that's why we're here today. The reason we're here is about prevention, encouragement, and hope. So thank you for coming out today and joining in the effort on these important heart disease tips. So remember to please go home and share the video and save a life. I'd like to welcome up to the podium our fantastic partner and friend, City of Phoenix Mayor Greg Stanton.
All right, thank you, Allison, so very much. It's great to be here today. The City of Phoenix continues to build on its great relationship with the University of Arizona, particularly the College of Medicine, Phoenix. The investment made by this university in the heart of this city has benefited the city in terms of the built environment, and also, of course, benefited the health of the citizens of Phoenix and the entire Valley of the Sun. We love the University of Arizona in downtown Phoenix. Bear down. Dr. Galati, thank you so much for sharing your expertise and insights. It is a real eye-opener when you learn that heart disease is the #1 killer of both women and men. But more than 80% of heart disease can be prevented. So I'm so pleased that DeSoto Central Market has been chosen as the backdrop, not just for this event, but for this incredible video series that will be seen by people all over the country and the world. Dr. Galati, you will be a YouTube star. I can't wait. Remember us little people when you're famous. That's a win for healthcare as well as a win for adaptive reuse and transit-oriented development, all the things that we're trying to accomplish here in the city of Phoenix. We already have a successful ongoing collaboration with the U of A through our Fit Phoenix and Wildcat Night at Verde Park, where medical students work with young residents, teaching lessons on health and nutrition and the importance of physical activity. It is never too early to share the message of heart disease prevention, or too late for that matter as well. When we were first thinking about the Phoenix Biomedical Campus, we had a vision for what it could become, and this is another important milestone in that continued partnership. We knew that a downtown medical school would have remarkable ripple effects. 10 years after the launch of the U of A Medical School and the Bioscience Campus, we are seeing the fruitful efforts of the Biomedical Campus and how the medical school, along with its faculty and students, can truly impact our community. And this case our nation. I love the fact that the students and faculty, the entire ethos of this medical school is not inward looking but outward looking. How can we benefit people all across this community and across this globe? This latest effort is something very special. This thoughtful, upbeat, and inviting video series using DeSoto Central Market and Phoenix as the backdrop is a smart and innovative way to educate the public about the important health concern. So I applaud the University of Arizona and our friends at Banner Health for its shared goal of improving the lives of Arizonans by highlighting heart disease prevention in such an accessible and shareable format. So do me a favor, watch this video and the ones that follow. Post them on your Facebook site, Twitter, Instagram, whatever social media you use. Make them go viral, which is usually what we try not to do in healthcare. In this case, it's a good thing. And in this case, it could save a life. And now I would like to introduce the director of the Arizona Department of Health Services, Dr. Kara Christ, to come say a few words. Dr. Christ.
Good morning. What an honor to be here on such a beautiful day and about such an important topic. As a physician and the director of the Arizona Department of Health Services, there's no better message to share with you today than the message of heart disease prevention. Heart disease has been identified in Arizona as a leading health issue and has been singled out as one of the leading health issues in the Arizona Health Improvement Plan. It has been made a priority where we will be looking at strategies and ways to get information out about how to prevent heart disease. To let you know how important it is, in 2014, almost 10,000 people died of heart disease. We had 82,000, almost 83,000 hospitalizations because of cardiovascular disease. And 7% of people self-report that they have heart disease when we ask them in our community surveys. And 30% of those people report having high blood pressure, which is one of the main risk factors for heart disease. So we know that this impacts Arizonans. And if we could reduce cardiovascular disease and stroke by 10% by 2020, we would save almost 1,300 lives and over $6 million in healthcare costs. Our loved ones, all men and women, our families, our neighbors, deserve to know that 80% of heart disease can be prevented with proper exercise, a proper diet, reducing stress, and getting regular medical checkups. We can work to prevent heart disease in our loved ones. So knowing that high blood pressure, high LDL cholesterol, and smoking are key heart risk factors, and that about 49%, so almost half of Americans have one of the three risk factors for cardiovascular disease. Because of all of this, we are so excited to have been asked to partner today in the launch of Dr. Galati's video series. We think that this is an innovative and unique way of getting messages out. What a fantastic way, especially to talk to women, to have somebody who understands, and to get it out in a method that it speaks to today's community. So we are... I'm a Wildcat, and I'm a graduate of the University of Arizona Medical School, so go Wildcats. And I'm so excited that they are taking the first steps and bringing this challenge to the forefront. And thank you, Banner Health and the University of Arizona for your partnership in bringing excellent health care to the innovative biomedical campus in Phoenix. And bear down. Remember to share the videos. Make sure that you share it with your loved ones, your coworkers, your neighbors, because this could truly save a life. And I would like to, I get the honor, so I'm so excited of introducing Dr. Martha Galati, Division Chief of Cardiology at the University of Arizona College of Medicine, Phoenix, and Physician Executive Director at Banner University Medical Center Cardiovascular Institute. Thank you.
Well, I'm so honored today to be here in front of you, and I'm so honored that University of Arizona and Banner University Medical Center have had the thought to actually promote heart disease, specifically related to women. The fact is, in the United States, 42.7 million women are actually living with heart disease right now. That's compared to when women think about the issues that affect them, they usually think about breast cancer, right? Actually, only about 2.9 million women in the United States are living with breast cancer. So just to put it in a perspective of what women need to know, they really need to know about their heart risk. Another way to think of it is in the United States, just under 400,000 deaths a year are due to cardiovascular disease in women. And about 40,000 deaths are due to breast cancer. So we need to make women aware that the number one cause of death is heart disease. And we need to know that in order to help prevent the disease. The reason that I am so focused on preventing heart disease in women is the fact that we underdiagnose heart disease in women. We undertreat heart disease in women. We miss a lot of women who are having heart attacks. We also haven't even studied women in many of our critical trials. We decided to exclude women because they have this nasty habit of, getting pregnant, going through menopause, the different things that I guess men don't do that are unique to women. Yet those things that make us women are the things that might accelerate our risk. I'd like to tell you just a story because it always reminds me of why I went into this field. When I was taking care of a patient, I was taking care of the husband a week before, and the husband, came in with crushing chest pain, some shoulder pain and chest pain, ended up getting a cath. We put in a stent. We saved his life. He came in for his follow-up visit, and his wife came along with him. And the wife said to the doctor, after he said everything was good with the husband, she goes, I just wanted to ask something because he had some shoulder pain. I'm actually having some shoulder pain. I just wondered, should I be worried about my heart? And the doctor said, what side do you carry your purse on? And she said, on the left side. He goes, carry it on the right. That night, she woke up in our hospital. She came to the hospital having a heart attack. We were not able to see her at risk. We never see women at risk for heart disease. So we have to change that, and we have a lot of work to do. The great thing about University of Arizona is all our research within the cardiovascular division is we are going to be doing studies on women. We're going to be including women in our studies. And if there's men and women in the studies, we're going to be stratifying by sex to see if there's a difference. Within our hospital at Banner University Medical Center here in Phoenix, we're very fortunate. We've opened the first women's heart center, not just in Phoenix, but in the state. So we are going to be taking care of women and making them know that heart disease prevention and heart disease treatment is our priority. So I hope that by this video series, we can reach more women, not just in our city, not just in our state, but beyond all our borders. That we can make women know that heart disease is their number one killer, but yes, 80% or more of it can be prevented if we just know what to look for. That knowing your risk factors, knowing your numbers can be all the difference that it takes in terms of watching someone die from a heart attack or watching someone not even develop a heart attack. The people we care about is our women and our men, but it's the youngest women that are dying at the highest rate. A young woman who presents with heart disease is more likely to die than any other group. All the other groups, we've made huge inroads, but young women are the ones that we are losing the battle in. We know that unique risk factors, you already heard about the traditional risk factors, but unique risk factors like eclampsia, preeclampsia, gestational diabetes, things that happen during pregnancy accelerate young women's risk of developing heart disease. And yet many of those women never get talked about their risk for heart disease. So let's change this together, share the video, save a life. Let's be in this together. And thank you again for all of you coming today and going red in September when I know it's really in February, but we're going to go red like U of A does all year round. So thank you.